This skull should have belonged to a dead man. But someone had deliberately removed part of the bone. The opening was not jagged or accidental. Its edges were smooth and rounded. They had begun to heal. And bone only heals in the living. So this was not damage caused after burial. The operation happened while the person was alive. And somehow, the patient survived. So why were ancient Peruvians opening living skulls? Archaeologists call this procedure trepanation. It was one of the oldest forms of cranial surgery. The goal was to remove part of the skull bone. Some healers slowly scraped the bone away. Others carved a circular groove. Some created rectangular openings. Others made several small holes around the edge. Different methods appeared in different communities. Slow scraping gave the healer greater control. And control could mean the difference between life and death. Today, researchers study these skulls like medical records. The shape of the damage reveals how it happened. But the most important evidence lies along the rim. Freshly cut bone has sharp, unfinished edges. Bone from a survivor begins to remodel. The body gradually smooths and rounds the opening. That process takes time. Some skulls show only early healing. Others show extensive repair. Those patients may have lived for months or years. The strongest explanation begins with head trauma. Warfare in the Andes could be brutally physical. Clubs could fracture the skull. Sling stones could strike with enormous force. Some people survived the first blow. But broken bone could remain pressed inward. That could damage tissue beneath the skull. Removing the fragment may have reduced the danger. The wound could then be cleaned and treated. In many cases, trepanation followed a clear medical logic. Some recovered patients may have returned to ordinary life. And healers could learn from every case. But not every trepan skull shows a visible fracture. So injury cannot explain every operation. Some patients may have suffered severe headaches. Others may have experienced seizures. Some may have lived with swelling or infection. These illnesses rarely leave obvious marks on bone. So their exact role is difficult to prove. Medicine and ritual may also have overlapped. For ancient Andean people, body and spirit were not always separate. A practical treatment could also carry sacred meaning. The same operation may have served several purposes. Some openings may even have been symbolic. Others may have been performed after death. Healing helps researchers distinguish living patients from burials. The practice also varied across regions. And it changed over long periods of time. There was probably no single universal reason. But treatment of injury remains the strongest pattern. One mystery is how patients endured the pain. Ancient Andean healers knew many medicinal plants. Some preparations may have calmed the patient. Fermented drinks may also have been used. But the exact method of pain control is unknown. Assistants may have held the patient still. The scalp first had to be opened. Then the bone was worked little by little. Open-air treatment may have reduced some contamination. And simple stone tools could be extremely sharp. The healer had to stop and check the opening repeatedly. A shallow angle reduced the risk of going too deep. Afterward, the patient needed rest and care. Recovery may have begun under family supervision. Bandages protected the healing area. Tools and debris had to be cleared away. Young apprentices could observe successful cases. And experience slowly became tradition. Early operations were often rougher. Later openings became smaller and more controlled. Over time, healers learned where not to cut. They refined both their tools and their judgment. Recovered patients may have strengthened trust in the practice. Communities saw that some people survived. Researchers can trace this improvement across generations. Different skulls preserve different stages of that learning. Some openings are wide and irregular. Others are precise and heavily healed. The overall pattern suggests rising skill. This was not random experimentation. It was a medical tradition built through experience. That becomes clearer when early and later cases are compared. Later healers appear to have avoided more dangerous areas. They also used more controlled techniques. Survival estimates improved over time. One major study examined 66 people. Together, they had more than 100 skull openings. About 83% showed signs of survival. These are archaeological estimates, not hospital statistics. But the healed bone still reveals remarkable success. The most dramatic comparison comes much later. During the American Civil War, skull surgery remained dangerous. Infection killed many wounded soldiers. Doctors still lacked antibiotics. Metal instruments could carry contamination. Researchers compared those outcomes with ancient Peru. Some ancient samples showed higher estimated survival. The procedures were not identical. And the evidence comes from different kinds of records. But the comparison overturns a simple assumption. The skulls still cannot tell us everything. Bone records injury and healing, but not the patient's voice. We do not know what they called the operation. We do not know every tool or medicine they used. Ritual and treatment may have existed together. Modern categories may not fit their worldview. These were real people, not medical curiosities. Their remains deserve careful and respectful study. The story is larger than surgical technique. It is about the people who carried and received that knowledge. So why did ancient Americans drill holes into living skulls? The clearest evidence comes from ancient Peru and the Andes. Many operations probably treated serious head injuries. Healers removed damaged bone and cleaned wounds. They may also have tried to relieve pressure or pain. Some procedures probably carried ritual meaning. But the operation was deliberate and repeatedly refined. Many patients survived long enough for the bone to heal. This was genuine cranial surgery, not modern brain surgery. Ancient healers learned how to keep people alive.